Hello, my name is Huisman. I am from the Netherlands and I want to thank you for your time and attention for this short presentation on the LekCheck study. I have no disclosure. This multi-center international prospective registration study was done in 2016 till 2018 in 17 hospitals around the world. The intraoperative patient, surgical and anesthesiological factors were collected via LekCheck. The LekCheck was an intraoperative web-based timeout. From a cohort of 1,562 patients, 132 anastomotic leaks were found. This was accompanied by a mortality rate of almost 6%, and the mean length of stay prolonged up to 20 days versus 6. We found 7 possibly modifiable intraoperative risk factors significantly associated to colorectal anastomotic leakage. Let's start with patients with a low preoperative hemoglobin, men lower than 10.5, women lower than 9.7. The odds on leakage was 5 times greater than without anemia. If the anastomosis was considered to be more than normally fecal contaminated, that anastomosis had a 3 times higher chance of leakage. A high blood sugar was accompanied by a 3 times higher risk. If vasopressors were given or the operation took longer than 3 hours, this risk was twice as great. And to finish, epidural use or antibiotics given outside of the time span of 15 till 60 minutes prior first incision, the odds were almost twice as high. This next slide gives us a visual. All patients together are in the dark blue bar with an 8% leakage rate. If you split them into the number of present intraoperative risk factors found from the previous slide, then the yellow group has 3 or more present risk factors, and they have a leakage rate of 21%. If we could bring these 502 patients into the gray bars, we would decrease our leakage percentage. Last, I would like to zoom in on our intraoperative glucose levels. Dividing the patients into diabetics and non-diabetics, with diabetes being a significant risk factor. In the non-diabetic group, we see that patients with a higher sugar level than 110, they have a 10% leakage rate versus 4% when they have normal glucose levels. This is a significant difference that is not found in the diabetic group. 30% of the non-diabetics have high glucose. Do these patients possibly have prediabetes, or is this surgical stress? But it is associated to leakage. Conclusion, be aware of the intraoperative patient because optimal intraoperative patients have very low leakage rates. Thank you.